Welcome to this protection teaching video. My name is Mugisha John and I work with Ministry of Gender, Labor and Social Development. I am a probation and welfare officer and I'm glad to have you watch us on this video. Get excited, we're going to be reviewing the protection of children and women, especially during this COVID-19, looking at the current issues that are affecting them. Can't wait for you to dive in. So I'm very excited to take you through the protection of children, women, and families during COVID-19. We're looking at the current risks, the prevention, and response mechanisms. Well, in this video, we're going to have an outline, and we shall have different sessions, which will be 8 in number, that we shall be going through. The first will be looking at the welcome and the introduction. And then the second will be an overview of gender-based violence, violence against children, violence against women. And the third will be the cost of violence. What is the cost that is there in regards to violence? Then the fourth session, we shall look at all the above in terms of the gender-based violence, violence against children, violence against women, but in the context of COVID-19. Then session 5, we shall look at the mental health, stress, and violence. And then session 6, we shall look at the protection of children, especially during COVID-19. And then session 7 is how do we respond? We shall look at all that. How do we be able to respond to address the issues that arise? Then session 8, we shall look at case management and the referral pathways that we have. Just something for you to note, especially when it comes to our learning objectives of this video. We want you to be able to identify the potential risks of the different forms of violence against women and children and the sexual and gender-based violence in the context of COVID-19. And then to understand and review the local appropriate guidance, prevention, and response actions. So let us begin with session 1. The overview of why this video. You might be asking yourself out there. We just want to provide an overview of the gender-based violence, violence against children, violence against women, but in the context of COVID-19. Maybe what you need to understand, especially key principles that will inform this session, they will be about strengthen best, looking at the useful for here and now, but also forward in terms of what will come, informing the global guidance, and also children's rights, especially the instruments that we have in place, bringing all that into a context to fit within the purpose of these practical sessions. So an overview of violence against children and violence against women. This is our second session, so let us look at the background and the definitions. So by definition, according to the Children's Act as amended of 2016, it defines violence against children as any form of physical, emotional, or mental that incurred or abuse, or neglect, or maltreatment, or exploitation, including sexual abuse, intentional use of physical force of power, threatened or actual against an individual, which may result in or has a high likelihood of resulting in injury, death, psychological harm, or maldevelopment, or deprivation. So that is the definition that we look at it basing on the Children's Act. Key definition, especially around sexual and gender-based violence. It's any act, any sexual act that is perpetrated against a person's will and is based on the gender norms and unequal power relations. Now, when it comes to intimate partner violence, this is referred to as ongoing or past violence and abuse. It is described as physical violence, sexual violence, stalking, psychological harm by a current or a former partner. You could be an ex out there, you could be a cause, or a spouse. So it is the most common type of violence against women, this intimate partner violence. So key messages on violence. The violence is never okay. The government of Uganda is committed to prevent violence against children and women and gender-based violence across all spectrums of life in Uganda. The core function of the social workforce, like myself, is to identify and prevent violence and support anyone at risk or experience violence wherever they are. The workforce should use the power. You who's out there, who is listening to this video, and you are part of the social workforce, you should use the power that you hold to positively to ensure safety of those who are survivors and refer and link these survivors to appropriate services. So it's always good to put things into context. Let us look at an overview of violence against women. Did you know that 1 in 3 women worldwide has experienced physical and, or you could say, intimate partner violence or a non-partner sexual violence in her lifetime? This is according to the World Health Organization 2013. Did you also know that 35% of the women worldwide have experienced either physical or sexual intimate partner violence or non-partner sexual violence? These are the global statistics that we're giving you. And also globally, as many as 38% of all the murders, which of women are committed by intimate partners. When you hear scandals of a woman who has been killed globally, most times it is someone who has been an intimate partner. Maybe the woman has moved on, things of that sort. Then women who have been physically or sexually abused by their partners report high rates of severe impotent health problems. You find a woman cannot conceive, because of the thought, because of the hitting. Each time she gets a child, she loses the child. These are the global statistics. It's always good to see the context. So, women who have experienced intimate partner violence, are 16% more likely to have a low birth weight baby. You see the women who come to the hospital and the child is supposed to be 2.5 on average, at least minimum, and the person has produced a child who's maybe 2.0, So more than twice are likely to have an abortion. Like I said, they will lose these children after they've been hit. And then increasing risks for unintended pregnancies. In most cases, we have seen it that children are called as mistakes. Why? Because the father and mother fought, and then in that process, they had sexual intercourse. So you find that they have unintended pregnancies. Then, of course, sexually transmitted infections. Then, of course, miscarriages, where you find they have been beaten and the child, they lose the children that they are holding in their wombs. So in some regions, 1.5 times more likely to acquire, HIV/AIDS. You can imagine. Because in that moment, there won't be any things like protection. There won't be consideration of what is happening, all this. So as compared to the women who have not experienced, partner-based violence. So all this happens. Then these same women, are poor mental health outcomes, including post-trauma stress. These will develop eventually. They will have depression, they will have low self-esteem, and of course some will tend to now drive towards taking alcohol and of course drug abuse. So women who have experienced intimate partner violence are twice likely to experience depression. These are the women you'll find who cannot stand up for themselves, cannot say anything in the public because they are in this depression. But you can also make a reference this to the World Health Organization of 2013. Physical injury, disability are some of the other things that will come out of the violence that will happen, especially around intimate partner violence. You'll find someone who was not disabled, they are now disabled. And even sometimes, even death. We have seen many women who have gone like that. Some commit suicide, others are murdered within their own homes. And just for a bit of statistics, 42% of the women who have experienced intimate partner violence report an injury because of the violence. So some lady will come and report her partner that has beaten her the whole night, and she'll say her head is hurting, her leg is broken, her arm is broken, her back is injured, something of that sort. So financially, burden associated with the violence will also come out, because someone has to pay medical bills. There will be issues of legal services. There will also be that bit of relocating, seeking refuge from the violence. We have seen women going to shelters. We have so many shelters across the country. An example is just in Kampala, where we have Action Aid having a shelter. Many of the women that go there have actually experienced violence. So then, of course, limits on learning or earning potential because of the injury or inability to work. Some of these women work in markets. They work in high-ended jobs. They are personalities, but because of the injuries, they will not be able to go to work. So meaning even their income will go down. And of course, the violence, the intimate partner violence, curtails the education achievements. Someone not, go beyond what they would have. In regards to violence against children, let us look at an overview of violence against children. Globally, nearly 1 in 3 adolescent girls aged 15 to 19 have been the victims of emotional, physical, sexual violence perpetrated by their own partners. In other words, what we are saying that someone who has been in between the age of 15 to 19, in most cases, the people who have perpetrated violence against them could be their partners. I know at times we say children don't have boyfriends and girlfriends, but these things happen and you find children get into relationships. So most often, sexual violence against children is perpetrated by an adult known to the child. So such as a neighbor, a family friend, stepfathers, uncles, cousins, grandfathers, and fathers themselves. It's really shocking that you find a father, having sexual intercourse with his own daughter. So evidence shows that globally up to 1 billion children are affected by violence each year. 1 billion. That is something for you to note. So across Africa, at least 50% of the children between the ages of 2 and 17 have experienced one or more forms of violence, excluding what we call spanking, is the beating. You have those who have been slapped, different forms like that in all settings. So the gender dimensions of violence against children, girls in most cases have experienced sexual violences more than the boys, while the boys have experienced physical violence. However, sexual violence against boys is also underreported. In most cases, boys will not report that they have been sexually abused compared to the girls. So let us look at the influence of culture and the social norms in regards to violence. Cultural practices and social norms about gender concerns, e.g. equality, equity, power relations, biases, stereotypes, and the acceptability of violence against women and children play a great role in violence in the communities. The cultural practices and social norms include the normalization of violence, taking violence to be something which is part of the culture, the justification of physical abuse or physical violence as an acceptable means of discipline, that the child has failed to wash dishes, so therefore you get sticks, bricks, and hit the child just to emphasize a point, or even burning a child's hand, The low status of women and girls, the belief that women and girls shouldn't own land is an example. The perpetration of violence, is looked at as a family matter. You cannot interfere with someone's family because they think they have their own rules that they should follow, Then forced and early marriages, where you find someone is not willing, wants to continue with her studies, or a lady wants to continue with her plans as she aspires, and then she's pushed into this marriage. All these are part of those cultural and social norms. Then we have, of course, female genital mutilation, which is a very common practice, especially in some parts of this country of Uganda. These are the different things that come in. So all which discourage the survivors from seeking help, because it will be put into the minds of those who have experienced violence that it's normal, it's part of our culture, So violence against children and gender-based violence can be prevented through changing community norms about the gender concerns, through scaling up community mobilization programs to change violence-related behavior, and promoting more equitable relations between men and women through awareness creation, dissemination of IEC materials on violence against children and gender-based violence. Holding perpetrators accountable rather than blaming the victims and the survivors. It's very important that people see the perpetrators being removed from the community, being taken to courts of law, being arrested, serving time in prison. That will create a change than blaming the victims, because most times the victims, they're innocent, or stroke the survivors. Okay? Ensuring a comprehensive response by mobilizing a referral network of service providers in the community to work together will create that change in terms of preventing violence against children and GBV. We're now going to look at the cost of violence, and this is session 3. The cost of violence, if you look at it in a spectrum of different things, it will get you to understand that there are a lot of dynamics that will occur if someone does not do anything to address violence. So what we're saying is this. So when violence occurs, it inhibits the optimal brain development. It also reaches a point and affects the psychological behavior, of a person, creating these different problems, how someone is supposed to behave. And also it brings in depression. You have someone who's depressed all the time. You have people who are anxious, it brings in anxiety. Then, of course, it brings in post-trauma stress, where you find someone is always unstable. Wherever they are, whenever they hear a sound, they're always jumping. You find someone who's always wanting to commit suicide. We have seen people climbing up buildings and jumping off buildings, people going in a bush and, hanging themselves, the tendencies towards suicide. Then, of course, self-harm. We've seen those, especially it happens with children, when they have experienced violence, they will tend to hide away and they can create self-harm, maybe cutting themselves, maybe drowning themselves, different things. And then, of course, they themselves perpetrating, violence, because in most cases, children, what they see is what they do. So when they experience violence, they will also perpetrate violence. Then, of course, risk-taking behaviors. You'll find that a child will now undergo the use of drugs, taking alcohol, having unsafe sexual practices. All these are the different things that come in as a point of violence. So, therefore, do we ask ourselves sometimes, is there an economic cost of violence? I would say yes. And broadly, it's divided into two kinds. The first is direct costs, which are more immediate and measurable. These are the ones that you can easily see that are there. And then, of course, the indirect costs, which arise from the impact of violence. That after the violence has occurred, there are certain costs that will come in. So, for us to best understand this, we shall use an illustration. Okay? We have those that are medical and non-medical, for example. These, we shall term them as the direct costs. For example, under medical, when a person has experienced violence, they will be taken to a hospital. Either they will be admitted or they will be coming from their home, going to the hospital for services. And then, of course, when someone has experienced violence of any type, they will have to be transported, either to the hospital, to the police, to where the services are. Then, of course, seeing a physician, someone to examine them on the violence that has happened to them. All this will have a cost. Then, of course, drugs and other tests that will have to be carried out, including the counseling of this person to come back to normality. So this could be an example of those that are under medical. But when you look at the non-medical, which are still under the direct costs, there will be a cost in terms of, policing and imprisonment. Getting the police to move, arrest this person, or that there will be a cost in there. Then, of course, legal services. We know there are few people who give free pro bono services in this country. But we know that the legal services, there will be a cost implication, because sometimes people go at it independently. They have private lawyers. There will be a cost paying legal fees and all that. Then, of course, there will be a cost in foster care, especially around the children, because they won't be going back to this abusive family or this abusive environment or setting. Therefore, there will be a cost. The person is going to look after these children. Then, of course, because of the fear that is happening or the fear that is within the family, there will be a cost of getting private security. We have seen people moving around with bodyguards, with people for protection. All this may be as an attribute to violence that I've experienced. So this could be the direct costs, both medical and non-medical, for example. So both direct and indirect costs have a short and long-term effect. So there are those that you can feel now and those that you will feel in the long term. So in terms of the indirect costs, we can begin with those which are tangible and then look at those which are intangible. So the tangible ones. One could be the loss of productivity. Because a woman has been injured, she won't go to the market to work. And therefore, her earnings and time she will lose. Then, of course, lost investments in the social capital. Because of the money that you are trying to save here and that for that, you'll find you are now putting it into other costs. So that will also have an implication. Then, of course, life insurance. Then, of course, protection. And then, of course, the microeconomy. In terms of those that are intangible, we shall look at those which are health-related, quality of life, because then someone's lifespan now starts to dwindle because of the violence they're going through. Then, of course, pain and suffering, then psychological and other qualities of life, all these will be affected. Then, of course, reduced job opportunities. If you are the perpetrator, you may not be employed anywhere. Someone may remove you from a job because of the violence you've committed. And then, of course, access to schools and public service, all these will be affected. Session 4. Let us look at the increase of violence against children and violence against women, especially during COVID-19. So 1 in 4 women, I have to say, have experienced domestic violence within their lifetime. Yes, 1 in 4 women have experienced domestic violence within their lifetime. Maybe you have not yet experienced it, but you could experience it. But I pray you don't. So on average, a woman will return to her abuser 7 times. That means that if this woman has been beaten by this man, or they have had some sort of violence within the home, and she says, I have gone back to my parents, she will go, and within a short time she will be back. And again, the violence will happen again, and again she will go. So it is said that she will return 7 times. But the question is, why will she return all those times? So it is believed that she might believe that it is she to blame on how things are happening within the family. Then, of course, the issue of children. Then, of course, fear, Fear can always cripple in and someone says, let me go back, What if this man comes here? Then, of course, going back to your parents, you may be coming from a family that doesn't have resources. So the lack of resources could be also a point. Then, of course, the issue of the power dynamics, feeling powerless, You don't have the power. Then, of course, the cultural pressures. The culture saying, once the man has given us our cows, has given us our dowry, you have to stay the other side. So the pressure could also push this lady back. Then, of course, the promises of change. As you know it, most times the partners that normally commit this violence tend to be remorseful because maybe they got this violence from the young age, looking at their parents. So they will look back and act remorseful, and this woman will return only to be battered again. Then, of course, lack of options. Someone doesn't have options. Where do I go? What do I do? Then, of course, lack of support. You've gone, you're saying the man is beating me. The man has done this. The man defiled our maid and all these different things. And then the family is saying, so what? It's your family. Go back, In the context of Uganda, especially when it comes to gender-based violence and violence against children, especially in the context of COVID-19, we have seen a progressive increase since the implementation of the containment measures that began. For example, calls to the Uganda Child Helpline, which is also known as Sauti 116, significantly increased since the implementation of the containment measures, peaking within from the time we were in May, we had around 41,977 calls. So you can look at it as an average of 1,354 calls a day, meaning people are calling in to report all forms of violence that were happening to the children, especially when we were in the lockdown. Then, of course, we had increased reports on gender-based violence. We had 3,280 cases that were reported to the Uganda police between March and April, with additional 283 cases that also came in. Then, of course, reports on violence against children progressively increased since schools were closed. You remember, His Excellency did say we have to protect the 15 million who are in schools, and that's why the schools had to be closed. So, but in that process, we saw that in August, over 40% increase in terms of cases of violence against children. So all these were giving in the context of Uganda, how COVID has affected and increased violence. So violence against children and gender-based violence has serious consequences for women and girls' mental and physical well-being, including their reproductive and sexual health. It remains a social justice, human right, and a public health issue. One thing that we need to know is that domestic violence during the coronavirus disease pandemic has been adeptly described as a shadow pandemic. In other words, it was there, but wasn't really being mentioned. It was not really being focused on, okay? So it was described as a shadow pandemic by the Executive Director of the United Nations for Gender Equality and the Empowerment of Women under the UN Women. So they described it as that. But then, violence against children and gender-based violence have linkages. We want to see those linkages. So, one, you need to understand that they happen in the same place. They have common consequences. They have shared risks and factors. And of course, they're intergenerational. So, partner abuse and child abuse often happen together. That's why we are saying they happen in the same place. If they are beating a mother, the children are most likely also being beaten. If they are beating one another, the children will also be affected. If there is a other form of abuse, like emotional abuse, most likely even the children are being affected. Then adult physical violence often is accompanied by child neglect, because then the man wants to show power and maybe wants to show the woman that, okay, you've gone, you've done this, then I also want to support the children because you have left, you know. And then, of course, they have similar physical and emotional results. What will happen under VAC in terms of children will also happen under the adults. They will all have the same. If you slap someone, it's the same pain that even the child will feel. If it's about emotional, it's the same feeling. Then, of course, often exposure to different forms of violence makes the consequences worse. Because this has happened, then the protection of the family is affected, and therefore even other forms of violence happen. Then, of course, issues around, in terms of the shared risks, we're looking at issues of the gender inequality, the economic stress, the poverty, the family pressure, the alcohol abuse, and the drugs. All this will happen, and of course the lack of supportive services. All this is just to show you that violence against children and gender-based violence have a shared link. Then, of course, partner violence impacts on child health and well-being, and children experiencing violence against children are more likely to perpetrate and be victims of gender-based violence as adults, because it will reoccur again in life. They will also again be the perpetrators because of what they had experienced. So why are the levels of violence increasing during COVID-19? They're increasing because the pathways can be both direct and indirect, and are likely to, interact and reinforcing existing vulnerabilities. So the pathways will depend on the types of vulnerability and the contextual factors, including the underlying gender norms and the levels of gender-based violence and violence against women and the violence against children. So these pathways linking with the pandemic, together with the gender-based violence and violence against children, are as follows. The first is, economic insecurity and poverty-related stress. 2, the quarantines and social isolations. We've had people saying they cannot stay within the quarantine centers or being isolated from other people, but these are part of the things. Then, of course, disaster and conflict related to unrest and instability, exposure to exploitative relationships due to changing demographics, reduced health services availability and access to fast responders, virus-specific sources of violence, then inability of women to temporarily escape abusive partners, then exposure to violence and correlation in response efforts. Violence, 9 is violence perpetrated against health workers and child protection staff. So all these are just to show you the levels of violence increasing during the COVID-19. I implore you to be careful. COVID-19 is real. Keep yourself safe. Don't forget to wash your hands, to social distance, and to wear a mask. Remember, your life is precious and we need you. For God and my country.